participated on today's tally, in part because we have a very exciting new presentation of all the data. We have a new website, new ways to look at all the COVID Colorado data. Dr. Rachel Herlihy, our state epidemiologist, will give you an update on all the features and how every Coloradan from their home can really look at the real data of who has it, who's hospitalized, where, when, in a really convenient way. Part of our goal to really empower people to make smart decisions in your everyday lives. Overall, Colorado continues to do well relative to other states. Again, America as a whole is not doing well, but Colorado is doing better than many states. We've had our lowest positivity rate since the testing program began at 2.18%. That's a result of two things: increased testing, that is the denominator, and of course a slight decrease in the prevalence of the virus as the numerator. So 2.18%. We have the fast, quick, free, easy testing sites: Aurora Sports Park, Waterworld, Federal Heights, Citadel Mall, Colorado Springs, Pueblo Fairgrounds, Pepsi Center. You don't need an appointment. You can set one up if you want online, but you really can just drive in. You'll be done in 15 minutes, in and out. Free, quick, easy. You don't need a doctor's note. We encourage anybody who's experiencing symptoms, cold, flu-like symptoms, cough, fever, get tested. And also, if you've been exposed to somebody who you think might have had COVID, get tested a week after that exposure, 7 days after that exposure. It doesn't do any good to get tested the next day because it'll be negative even if you are contracting COVID, but those results would convert about a week later. These tests are being turned around quickly. As we indicated, partly we launched these sites in response to the slow national testing labs. These quick, free, easy testing sites, 2 to 3 day turnaround. We've actually heard a lot of folks to get 2 day turnaround, but it'll almost always be by 3 days. But they're hitting the 2 day quite a bit, which is great. 2 to 3 days is reasonable. We're working on, of course, validating quicker saliva tests and other tests. Want to make sure that the accuracy is there. Part of the problem with the Abbott tests, which we still deploy, is they have a lower accuracy rate than the very highly accurate tests that we administer with our private lab partners at these testing sites. There's also a number of community testing sites across our state. You can go to the website that Dr. Herlihy will introduce you to, but it is a map in Colorado of those community testing sites that are updated regularly. Well, it's back to school time in Colorado. It doesn't look exactly like most back to school times. Yesterday I got to visit Village East Elementary School, part of Cherry Creek School District. The second graders were in class as part of a staggered school week. I got to visit the second grade classroom with my KN95 mask. I wore the same medical grade mask that we're giving to every teacher in the state, one per week. We made the commitment for 10 weeks. We hope to be able to continue it to make sure that they have those medical grade masks available. And we had a socially distanced meeting with educators, with paraprofessionals, with the union president, the school principal, superintendent Dr. Scott Siegfried, Dr. John Douglas, the director of Tri-County Health. It was a very good discussion. We were joined by our Commissioner of Education, Katie Anthis, and Senator Jeff Bridges, and Senator Nancy Todd. You know, I don't think there's a family or a teacher in Colorado that doesn't have multiple strong feelings about this back-to-school period. And those feelings are excitement, those feelings are fear, those feelings are relief, those feelings are frustration, and the same feelings exist in all of us. I have an 8-year-old and a 6-year-old, and they feature into Marlon's and my discussions at night, right? Fear, always worried. Does this mean that it increases the risk the virus could be brought into our household? What if there's an outbreak at the school? Relief, kids aren't meant to be kept up indoors, and our kids, like most in Colorado, haven't socialized as much this summer. A few, outdoor play dates here and there, and tried to get them some socialization. Our daughter did some camps. Our son didn't want to, but building those relationships. Relief, right? Relief that we hope that the school that they start actually next week in person will go well for them. and of course the excitement of kind of moving forward. So it's really all of those feelings that every parent has, and every teacher has too. Teachers care deeply about the kids in their class and those relationships. And teachers know and parents know that education isn't just about the academic piece. And first of all, on the academic piece alone, some kids thrive on online, some kids don't, some are somewhere in the middle. And the academic piece is important, but it's also about that social piece. How do you cooperate? How do you resolve conflicts? How do you build relationships with your peers? These are things that it's difficult to replicate virtually. So while for many kids, online will be part of their experience this year, for most kids in Colorado, that won't be the entirety of their experience. As I said, many of the districts in our state are back to school already, going back to school. Others are waiting a month to set up the process a little bit better just to make sure that they can do the cohort isolation and reduce the contacts people have. The goal here, like the goal across our entire society, we always want to be realistic. It's not to eliminate the threat of the virus. We don't have that ability as a state, and it's quite likely we don't really have that as a nation either. There are millions of Americans who have COVID-19, and it is prevalent in our communities here across the country. The goal is to prevent an outbreak level that would sacrifice our quality of care, our hospital capacity. And the goal is also to avoid prolonged school closures, business closures. And that's one of the reasons, if there is a case at a school, the first thing you do is you isolate just the class, right? Or the people that were exposed to that person. So rather than close a whole school, we hope it's just 25 kids that have a 2-week online learning experience. Now, there will be school-based outbreaks as well, and to be safe, we want to act on them early, right? And if there are kids across different cohorts in a school that contract COVID, then the kids will have to go online for 2 weeks. And I know that's hard for parents. And it's hard for administrators, too. You know, the very first question I asked Dr. Siegfried yesterday in our roundtable is I said, how do you handle it? Because you have, folks who are mad saying, what do you mean my 8th grader's only in 2 days a week? I'm a single mom. I work 5 days a week. What am I supposed to do those other 3 days? And then you have another family, let's say a teacher, saying, how dare you make me go in? I live with my 93-year-old mother. I've been staying at home all summer, and now you're saying I have to be with 25 kids every day in an indoor environment. And how do you do in every district, across our entire state, there's feelings. And I guarantee you, by the way, that mom who wants the 5-day service for their kids because she works and she's a single mom and she might not trust her 7th or 8th grader at home alone, she's also worried about the health of her kids. And you know what? That teacher that isn't ready to go back, that lives with their 93-year-old mother, that's been staying home and not going out all summer and has been so cautious, they also want to get back to the classroom in a safe way. The reason that they're an educator is they love kids, they love education. So those feelings on both exist in everybody, right? Just because one might win out for you doesn't mean it's the same one for everybody else. Many parents across our state in districts that are going back full-time or part-time are saying, we're not ready. Maybe we live with the grandparents, maybe your kid has asthma. And maybe online works well for your kid. They're saying we're starting the year online. We'll, look at it again maybe in the new semester and see whether we feel safe with our kid going to class. And that's a fine decision too. We want to empower everybody with the information that they need to make the best risk assessment for yourself, risk assessment for your family, make the best decisions that work, always guided by providing the best possible public health guidance from CDPHE and from the county health departments to the schools, just like other types of societal institutions, that they can do what they need to serve people the best. Now, in Cherry Creek's case, and in many districts' case, they started talking early in the summer to teachers, to parents, gathering a lot of information. Many districts polled their parents and teachers, and again, it's tough because I think it's clearly there's no consensus, right? I mean, some parents said, I need to have the school in person. Other parents said, I'm not sending my kid to school no matter what. Teachers want to make sure they had masks and are protected, and that they were just exposed to one cohort or two cohorts and not, 256 kids or 800 kids. And those discussions are very important. Getting the buy-in from families, from teachers. I know that process might take a little longer in some districts than folks may like, and still underway. Other districts are already back. And I'm not, going to say that everyone was comfortable with it. By their very nature, you can't please everybody with these kinds of decisions. But, when I was back yesterday at Village East, those second graders, they talked about how thrilled they were to be back with their friends, wearing masks, socially distant. They were in the room. I asked them how many had even been able to do summer camps or activities this summer. Only 2 or 3 of the kids raised their hands. For many of them, this was really their first time with their peers, which is so important for kids. It's also important to recognize that for many kids in our state, the school is often the safest place for them. When reports of child abuse when schools were closed, got reduced because a lot of those cases went unreported. Child abuse is often identified at a school, and suspicious circumstances are investigated. And when kids don't come into contact with loving outsiders outside the home who care about them, any incidences of abuse are a lot more likely to continue. Keep in mind that many parents work. 2 parents at work, a single-parent household that works, and if a kid's not in school, it might mean they're in a daycare center with one group of kids 3 days a week, with a grandma with 6 grandkids another day a week, and a neighborhood daycare with 5 kids another day a week. They, in many cases, might encounter and be around more kids than they would in one cohort in a school. So just as that's the case, it's also the case that there's other families where there's a parent at home who's able to work with their kid, either homeschooling or a formal online education program through a school district, and they're able to make that work for them. And families are varied in Colorado, and what works for one family isn't always the best option for another. Now, many districts are in person and meetings. Some are full time, some are 2 days a week. Other districts are taking a little bit more time to figure out how they are going to get back. And in the meantime, they have to, of course, continue the remote education and do the very best that they can with that. And we've encouraged those districts that are taking a little time to at least continue to open up their school sites as access points, as proctored daycare, for special ed. They won't have the full load of students, but for many families, those are really the center of the activities. They're critical for many kids. So even though there's not formal in-class sessions, academic sessions in some school districts like Denver Public Schools, that doesn't mean that they're not doing everything they can to serve families in their school buildings. And they are. And I've had a number of conversations with Susana Cordova, the superintendent of Denver, and other superintendents across the state, just making sure that if they haven't yet figured out how to resume in person, at least they are doing what they can in a safe way. Meaning for kids who don't have internet or computers at home, access points at school. For kids who need IEP or speech therapy, are they getting that in person at school? For kids who have nowhere else to go or need school lunch or school breakfast, are they getting that at the school site? And Colorado's not perfect, but by and large, our educators, our administrators, our teachers, our superintendents are really stepping up in an exceptional way. And I would ask parents to bear with them. I know that, some of you want to vent on different people for different things, and sometimes you have to do that, but just keep in mind that everybody's working as hard as they can in this difficult environment, and we all have a very short wick here, and I just want to counsel that people do their best to appreciate that hard work and know that there's no easy decisions in all of this. It's not an easy decision to say we're meeting 5 days a week full-time in a school. It's not an easy decision to say we're only online. It's not an easy decision to uproot everything and say we're figuring out how to do 2 days a week with different groups coming in 2 days a week. There are no easy decisions, and we want to make sure that everybody's empowered to make the best choice for themselves. The community, the parents, the teachers, the public health agencies. We want to empower our local communities to do what works. And parents have additional responsibility here too. Parents need to be extra cautious and observant about their kid. A runny nose, maybe last school year they would have sent their kid to school. But if your child is showing even the slightest symptoms, it is your responsibility to keep them home, get them tested. It's free, quick, and easy sites near you to do that. And create a plan so they're prepared if they do get sick. So if your child has symptoms, consult your doctor, get tested if it's needed. Tests are free, quick, and easy. Because if you don't do that, you might yourself, that a small irresponsible act of sending a kid with a runny nose to school might lead to your whole school closing. And that's not right. That's not right by the other parents. Not to mention it could lead to further spread of the virus, and some of those folks might have to be hospitalized. School districts work closely with their local public health officials as well. Every county is different. There's a different incidence of the virus, and making data-based decisions about how they're doing school, social distancing, cohort protection. Really, it's among our top priorities to safely get kids back to school, and I was just so happy to be in a classroom yesterday with second graders. I'm glad that my first grader and fourth grader will be going back to school next week as well. Now, with the success level we've had in the virus, the state is looking at variances again. There's two that were granted. The first of kind of the new round, Uray and Hinsdale, were granted. And we want to be very intentional about those future variances, very thoughtful, make sure the protocols are in place. In general, the way that we think about it is that the variances are a good process for site-specific protocols, like if you have a big fairground or stadium, what is the way you're going to operate that, and we want to empower you to do that. Where we want to go in the general stuff, like, we want a larger gathering size in general, is to push counties to go for the protect your neighbors phase. That means they show the public health capacity, low incidence of the virus, and then they sort of automatically get every exception that they would want to go to larger sizes versus just picking and choosing here or there. So we want to work to get with our counties to get as much open as they can, as quickly as they can, in a safe way. And of course, we all know that if we see a spike in cases, we need to make sure that we take additional steps to be safe. But what's working here, and this is why we want to continue what works. The mask wearing's working, folks, right? It's extremely unlikely that it's a coincidence that really a couple weeks after the mask wearing requirement is when we started to see significant decreases in the transmission. So that's continuing. That's continuing for another month. With the better data we have, we always inform our decisions around bars and late night events. It's always informed by the data, by the epi state of where we are. We are glad to be in a situation where we announced that last call will be moved to 11 o'clock rather than 10 o'clock. And I am hopeful that if the data continues to show the trend we have, I'm very hopeful that within a month that can then go to midnight, in a data-driven process that ties in the level of risk with transmission, with the presence of the virus in our state and the trend in the virus. But starting this Saturday, last call will be 11 o'clock. And it's very important that all those restaurants and bars observe the social distancing protocols, because there's no fooling the data, there's no fooling the math. If there's huge outbreaks, it means that we can't handle as a society those kinds of inebriated late night activities. But hopefully it'll provide folks a little bit more breathing room to get to 11 o'clock for last call in a safe way, meaning the bars that are open also are able to function as restaurants. They have food service. And then what's really important, it's not the food, it's not the alcohol. That's not what, those are proxies. Those are very important proxies. But what's important is the social environment. So if you're coming with 6 people, are you sitting at a table facing each other with the people you came with and hanging out and having a good time? And then there's another table 8 feet away or 10 feet away or whatever it is. The kind of freewheeling social environment where one person interacts with 86 people is what would lead to a instant super spreader event. And we would be right back where we were, and it would devastate not only our lifestyle, not only cost lives, but it would devastate bars and nightlife and restaurants because of that increased incidence. We're doing better than many states from a health perspective, and because of that, our economy is doing better than many states. It's one as a direct result of the other. If you look in western Colorado, I think a few months ago, many of our mountain towns and tourist towns, many people were worried they'd be down 50, 60, 70%. Who was going to travel? Because we've been successful in our health protocols and in finding new and safer ways to do things, many of our mountain towns have found that they've had a reasonable summer season. They're down 10%, down 5%, they're flat, but they've done a lot better than a lot of us feared. And while some of them have a little bit of a higher prevalence of the virus than the Denver metro area, they have not spiked to dangerous levels. They have been able to keep it contained. Many of them also have additional mask ordinances above and beyond the state one, by the way. Most of those mountain tourist towns have municipal requirements where you have to wear them outside in certain areas like their downtown. Statewide, of course, we're focused on indoors in proximity to others. So, our focus in all of this is transparency. We want you see the same information that we see and make decisions on. It's incredibly important that you have information, the data, the information, in the most accessible way. And that's why we're excited to really up the bar on ourselves with a new, strong, user-friendly, transparent way of accessing the data that we've been working on for some time. It launched moments ago. And to introduce it, I'll turn it over to Dr. Rachel Herlihy.
Great. Good afternoon. Thank you, Governor. So I'm very excited to share with you today the new website, data website that we have developed. As all of you know, as this pandemic has evolved, we've really changed in the way that our data needs have been represented. And our questions of the data and your questions of the data have really evolved over time as well. And so because of that, we've made these significant changes and improvements to our website. Some of the changes that you'll see on our new website include consolidating various data in one place, making the website more interactive and more intuitive. It's been redesigned for ease of use and to give users more control over how they want to sort and filter the data. We've substantially expanded the type of hospital data that we have available to you. Previously, the hospital data was limited to hospital systems type data. Now it includes patient level demographics, which is a really important change. We also are presenting much more detailed information on outbreaks, demographics associated with outbreaks, where those outbreaks are occurring, lots of information around outbreaks. Next slide. So this is what our landing page will look like. As the governor mentioned, this website is now live. The numbers that are there right now are yesterday's numbers. As we usually do, we'll be updating the website at 4 p.m. today with the current numbers. And so as you're used to seeing, you will see those boxes along the top that show you some quick facts, the stats on cases, hospitalizations, and other statistics on a daily basis in the state. And then below that, you'll see a series of gray boxes, and each of those is a tab that you can click on, and there are different types of data within each of those tabs as they are labeled. Below that is a series of quick facts that we wanted to have readily available on our homepage so that individuals could see some of the key facts, key data associated with our tracking of this epidemic. And you'll see that those are categorized into different types of data, including case data, hospitalization data, clinical data, and laboratory data. Next slide. And so the first tab that you come to is our case summary tab. This should look fairly familiar to you, but what you'll see here is that there's more tools and different ways to interact with the data. The first thing I want to point out to you is that on every single page in this website, what you'll see is a home button, which allows you to navigate quickly back to home. And you'll also see an information tab that you can click on to really get more detailed information about the data in each of these visualizations. And then on each of these pages, what you'll see is a series of boxes that you can click on to visualize the data in different ways. What I'm displaying here is case data, and I'm displaying it by reported date, and I'm also displaying the data by counts. You'll see that you can look at the data as cases, deaths, or you can look at maps, and we'll go into some of these examples in just a minute. You can look at the data on a daily basis, you can look on the data on a weekly basis, you can look at it for the dates when cases were reported to public health, or you can look at the data based on when an individual's symptoms started. So based on the day their symptoms started or the week their symptoms started. So lots of different ways to interact with the data and visualize it to really answer the questions that you might have about the data. Next slide. Again, moving on, within the same case summary tab, you can visualize death data. Here I'm showing you the death data weekly, and you'll see these color-coded lines that show you the number of deaths that have occurred in Colorado per week. You'll see they're color-coded to represent whether or not we've seen a week-over-week increase in the number of deaths or a decrease, and then they're labeled with the percentage increase or decrease from week to week. And this is really important, as we've talked about previously, in trying to help us understand whether we're seeing acceleration or deceleration in the amount of transmission that's occurring in the state. So again, you can look at this data on a daily basis, on a weekly basis. You can look at counts, or you can look at cumulative data. Next slide. That third tab is map-based data, and here you can look at case count data. You can look at case rates, so case counts divided by the population for each county. You can look at deaths, or you can look at the death rate per 100,000. So again, that death rate data. And then on the right side of this slide, what you'll see is sort of a ranking of the different counties in the state and the levels of disease incidence or the numbers of deaths that have occurred in those counties, both by counts or by rates of disease. Next slide. Next, we're moving on to the demographics tab, where you can look at detailed information about age, sex, and race and ethnicity of both cases and deaths that have occurred in the state. And so here I'm displaying for you cases and age group data. And what you'll see in this figure is you can see over time, and this is really one of the really important changes that we wanted to make to our data, is to allow individuals to better visualize our data over time. So what you can see here is the change in the percentage of cases among each of these different age groups over time and how that has changed throughout the course of the pandemic. If you look at the bars on the top, this allows you to see whether or not the number of cases that we're seeing in the state are overrepresented or underrepresented by certain age groups. If you look at those gray bars, that shows you the percentage of Coloradans that are in each of those age groups, and then the colorful lines show you the percentage of cases that are in each of those age groups. So when the colorful bar exceeds the gray bar, that is really where we see overrepresentation of a particular group among our cases. If the colorful bar is less than the gray bar, that means that group is seeing less overall incidence of disease than other age groups. You'll also see in the bottom right-hand corner that there's a little white box that appears. So for this figure, I was hovering over a certain data point. And so for all of these visualizations, you can hover over the data and get detailed information for each of the data points. Next slide. So moving on to the testing data, this should look fairly familiar to you. So this is the same way that we've been visualizing our testing data, the volume of testing that's occurring, as well as the percent positivity value. But what we are allowing you to do now is to really interact with the data in different ways, to look at the positivity values on a daily basis, a 3-day moving average, or a 7-day moving average. You can look at cumulative data or daily data, and you also can look at antibody testing data. And that data has been on our website, but it's been a little bit more difficult to access. So here we're trying to put everything on one screen so you can quickly toggle between different types of data sources. Again, you can hover on the data point you're interested in looking at and see some additional details about the data. Next slide. So this is where we have a significant increase in the amount of data we're showing around hospitalizations. We are both displaying hospital-level data on this site and patient-level data. First, I want to show you one example of the hospital-level data that we have. So this figure is showing you Coloradans that are currently hospitalized in Colorado, and it's showing you confirmed cases and then also something we call PUIs, which are patients under investigation or individuals who do not yet have a test result back. And so this is data that we're tracking over time to understand how many Coloradans are hospitalized at a given time. Next slide. You can also look at specific patient-level data, and this is completely new to our website. So what you're able to do is to look at hospitalized patient data in Colorado by age group, by sex, by race and ethnicity, and in this final tab, which I'm showing for you here, which is post-hospital location. So this data shows us where individuals have gone after their hospitalization. So it shows us if individuals have gone home, if those individuals have died, if they've gone to a skilled nursing facility, or to another location. Next slide. Next is our incidence and epidemic curve data. So this data should look fairly familiar to you. There are different ways to visualize the data. You can look at what has occurred in counties over a 2-week period of time, a 1-week period of time. You can look at it at the county level, which is new, or you can look at it at the regional level, which is what we've historically been showing on our website. One other really important change to our website with this type of data is that you have the option to exclude outbreak-associated cases, and this is really important when we have smaller counties in the state that are substantially impacted by an outbreak that might be occurring that's really not within their community. So an example would be an outbreak that might be occurring in a prison setting where those prisoners are not interacting with the community. And so we wanted to have this option to exclude those types of cases to really try and reflect the level of risk to individuals who might be visiting that community. Next slide. Next is more detailed outbreak data. So what you'll see here is that we've significantly increase the amount of outbreak data that is available. One of the things that we're doing, and I'm showing here, is you can visualize the types of outbreaks by these different categories. This data has been shown on our website just in sort of a spreadsheet, but now we've created some interactive tools so you're able to look over time at the types of outbreaks that are occurring across the state. And they're categorized into these 13 different categories: healthcare, there's restaurants, bars, retail, various categories, to try and understand where we are seeing outbreaks in the state. And you can look at this on a weekly basis or on a monthly basis. What's shown here is data on a weekly basis. Next slide. And next, you can also visualize outbreak data at the county level, and that's what's being shown here. And one other really important thing that we've done with this type of data is you have the ability to look at all outbreaks that have occurred in a county, or you can look at just active outbreaks in a county. And so what I'm showing you here is county level data that's showing you outbreaks, but it is only outbreaks that are currently active in these counties. And so you can see, based on the color and the graphic to the right, where we're seeing the most outbreaks in the state currently. Next slide. And finally is our CDC provisional death data. So this is death certificate data. So these are deaths that are coded on death certificates as due to COVID-19. This data is largely unchanged, with this one exception I wanted to share with you. So what is shown here is death data by age, county, race, sex, and week the death occurred. But we have also added this information about the location of where the death occurred, so where the individual was pronounced dead. And so you can see that there is information here about individuals who may have died in a hospital-type setting, a nursing home or long-term care facility, or a home-type setting. So again, additional information about the deaths that are occurring in the state. Next slide. So finally, I just want to share that our goals with this data continue to be that we have information available on our website that is really easy to find, that we are providing clarity around what the data means, how we are interpreting and using the data, and that's really why we have all of those information tabs accompanying all of our data sources, so that you can really have an understanding about how we're interpreting and using this data. Our commitment is continuing to be around transparency with data, and we really want to empower the public and our partners to have access to accurate, up-to-date COVID-19 data. And finally, I want to reassure everyone here that we are keeping the data and information that you have all come to rely on our website. So you will not see that there's missing data. We've not removed data elements from our website. So the data that you're used to seeing will continue to be on our website. It might just be presented in a slightly different way, more interactive, and more tools to sort of slice and dice that data as you'd like to. Thank you very much.
And that was very important to make sure that all the data that was available is still available, because we didn't want anybody thinking that in the switch to a better format somehow there was only different data. So we're just building. There's just more and more data. Everything you had before is still there. We think there's new and easier ways to look at it, but if you want to, time comparison over time with something you might have looked at a month or two ago, it should still be there. I got today's update: 356 new positive cases, 12,233 people tested. Good increase on the testing numbers. We have a lot more capacity to test more people if people want those tests. Some people say, why haven't you tested more people? It's because people aren't showing up to get tested. Absolutely. If you want to get tested, go to the Federal Heights Water World, go to Aurora Sports Park. They, I think, are repairing their tents for a day. They'll be open in another day. Citadel Mall, Colorado Springs, Pueblo Fairgrounds. Check the day of the week to see if they're open. Over 50 community testing sites across the state at covid19.colorado.gov. So if you want to get tested. If you're experiencing any symptoms, you think you're exposed to somebody. But today's numbers are in line with previous numbers. We got a good day for testing, and therefore we've identified a few more positive cases, which is a very good thing. 10 of the last 14 days downward trend. And we also, of course, at the end of the day, want to acknowledge those who paid the ultimate price, 1,815 Coloradans who have died from the coronavirus, over 1,900 that have died with coronavirus, but our condolences to each and every one of those families. Thank you so much, Dr. Herlihy. The final thing I want to mention, I went over briefly earlier, is the last call order. We're extending to 11 o'clock for last call. As you know from the very start, I'm committed to making decisions based on data and evidence. On our app, Curve in Colorado shows us Coloradans are doing their part, wearing masks, staying apart from others. For the past few weeks, cases have gone down, and as a result, the policy is being modified, and of course, we'll continue to evaluate future steps. My hope is it can be, midnight as soon as possible, and hopefully the data will bear that out. I also want to applaud restaurants and bars and cities that have adapted to outdoor dining. This is a great entrepreneurial adaptation that shows the Colorado spirit at its best. The 3 times that I've eaten out, I've eaten outdoors. And we know that being outdoors is 20 times safer than being indoors. And if there's any cities that are still dragging their heels, I would encourage them, get that permitting going and turn around in 24 hours, open up lots and streets and whatever you can. I love outdoor dining, and I hope that we can build upon it as we figure out a solution that works for the winter months. But at least for now, in September and October, usually great weather in Colorado, and really looking forward to helping our small businesses get through this by removing red tape and expediting any approval for that. We turn around a liquor license request in 24 hours for if they have a non-adjacent plot the restaurant wants to serve wine or mixed drinks at, 24 hours. And we hope the local governments are doing the same. So the challenge, of course, is to stay vigilant. We're all concerned about Labor Day weekend, and we all want to have fun on Labor Day weekend. And we just need to do it in a safe way. So it means with a small group rather than a big group, your family, maybe one other family, wearing a mask, of course, where possible. Try to keep the gatherings 10 or less. Outdoors, so much better than indoors. Let's be careful here so that Labor Day is not a setback for Colorado. We want to celebrate, working men and women and the labor movement, and we want to do that in a safe way that is sustainable. So, what we're doing is working here. We're in the midst of a rainstorm. We have an umbrella. It seems to be working. We need to recognize that the good results that we're having are because of our actions, the good choices that Coloradans are making, wearing masks, staying 6 feet apart from others, avoiding large gatherings, and we need to keep it up. And the more that we can prevent the virus from spreading, the more sustainable our lives will have, the more we can do, the quicker our economy will recover. And we look forward to helping Coloradans get through this difficult period and show how resilient we are and ready to bounce back. Happy to take some questions.
Governor, it's Mary Ann Goodland from Colorado Politics. What data have you relied upon specific to restaurants, bars, and similar establishments on these last call orders?
Yeah, the data we look at is really across the board, and Dr. Herlihy can address some of that as well. It's the epidemiological data. It's the scientific studies that are done that show how it spreads in different environments. It's the data from our tracing and figuring out where Coloradans have contracted or have likely contracted coronavirus who are diagnosed with it. And it's also a review over similar information nationally and internationally with regard to indoor dining and drinking establishments. Colorado's not alone in trying to figure this out. The European countries and across the United States and across the world, everybody's trying to figure out how people can have a nightlife experience during the pandemic without setting society and the economy back and costing tens of thousands of lives of their innocent countrymen and women. And I'll turn over to Dr. Herlihy.
Yes, so I think most specifically, we've seen a substantial decrease in the number of cases occurring among 20 to 29-year-olds. If you look at our age-specific data, which now you can visualize quite nicely on our website, what you'll see is a really substantial decrease in that age group in particular. And that, of course, is the age group we know that is spending more time in bar-type settings, bar and restaurant settings later in the evening.
20 to...
Yeah, I mean, look, I'm for extending it, as I said, to 4 in the morning. I think it's ridiculous that Colorado has a last call, and I've had discussions with legislative leadership, with mayors. I think there's an increasing consensus to move that to 4 a.m. That would have to be done legislatively. But yeah, I agree that these are outrageous steps that are being taken.
Governor, good afternoon. It's David Clue at Denver 7. I want to change topics for just a moment if I can. We lost a state park ranger this morning. He was attempting to rescue 2 boaters who were separated from their own boat when he appears to have drowned. Can we get a few words from you on the risks of that job and this particular loss?
Yeah, my condolences to the family. All of our law enforcement officials and our Colorado State Parks and Wildlife Rangers among them take great risks in that job, and it's risk of attack from wild animals, risk of doing rescues in remote places and themselves falling victim to rock slides or avalanches. It looks like in this case drowning. So I want to really show our appreciation for all of the amazing men and women, the federal rangers, parks and wildlife officers, and others that really do take on greater risks to help keep our amazing wild outdoor areas safe. That means safe for us and safe for the amazing wildlife diversity that they have. They're also the front line in enforcement efforts against poachers and illegal hunting, illegal fires, all of those areas that really highlighted, especially in this time with the enormous wildfires we have. I want to thank the work of both the federal rangers and state parks and wildlife in helping to enforce the fire ban.
Governor Charles Ashby from the Grand Junction Daily Sentinel. So as you may or may not know, Colorado Mesa University students came back to school this week, and they had a pretty good plan put together for in-school or in-person classes. The one thing they didn't account for very much was for back-to-campus parties, and there's something that they're addressing right now. So I'm wondering if you're thinking that this reversing to or going to a 11 o'clock curfew is the right time going on with that. And as Dr. Hurley, he said, the numbers that you have for your 20 to 29 kids going down, that's preschool, before coming back to school. So are you concerned that that's going to see a big reversal?
I'm very concerned about our residential colleges in particular for a couple of reasons. One is that they are residential. And if there's one thing we've learned is that congregate living facilities are at greater risk for the spread of the virus. Now, they're doing what they can in the dorms, they're doing what they can in the dining, but by nature of living together, it's a significantly increased risk over folks who return home every day. Second, yes, we're worried about the socializing that's customary and a meaningful part of a college experience. It's not so much the bar and restaurant piece that's covered under this order. It's the more difficult piece of private parties and events. It's people having house parties with 120 people, no social distancing. A lot of the municipalities, Boulder, Grand Junction, Fort Collins, have really upped the bar on enforcing their noise ordinances and other normal requirements that often lapsed and often are not enforced. But in this time, they take on an added significance, because if there's 150 people in a house, in a normal time, an officer might simply say, turn down the music. I think now, if there are complaints, they might be more formally trying to enforce that noise ordinance and make sure that people can safely return home. Yes, we're worried about private parties, we're worried about congregate care, working closely with all of the residential colleges in our state, as well as the non-residential community colleges and colleges, to make sure that they have the protocols that they need to be safe as possible for their students and for their faculty. And avoiding large private parties and get-togethers is a key piece of that, because those are super spreader events.
Governor, I wonder if you can go into more detail about this idea of switching from 10 to 11 p.m. I mean, is the thought that at 10 p.m. or at midnight there's going to be people who are more drunk than 11 p.m. than 10 p.m.?
Well, we're doing better, which is why we're able to do this. We were very concerned a few weeks ago. You remember we had doubled, which in cases that was the number we were at wasn't a worrisome number, but the doubling was. And if you didn't change something, you double again, and you double again, and then all of a sudden you're threatening your hospital system. So when we dug deep in the data and said, where and how is this happening, we saw the 20 to 29-year-old group spike. The data kind of showed what the interventions could be. We're now in a better place. Our viral presence has gone down, 30, 40%. And so we're able to extend those hours to 11 p.m. And nobody is more hopeful than me that we can get to midnight in a month, and as I said, hopefully permanently to 4 a.m.
Hello, Governor. This is Vinny Del Giudice at the Bloomberg News in Denver. An agriculture question. Can you or Dr. Herlihy provide an update on COVID-19 safety at the beef plants in Greeley and Fort Morgan? And are you worried about another spike at the beef plants this winter? Thank you very much.
In the preface to your question, I thought when you said agriculture, I thought you were going to ask about the droughts, because we are experiencing a statewide drought in Colorado. That's indirect effect to the beef plants. But I'll let Dr. Herlihy talk about JBS and Cargill.
Yeah, so certainly manufacturing settings, meat packing plants continue to be a high-risk type setting because of the closeness of individuals working in those settings. But we continue to work closely with those facilities. We have seen substantial progress made. We have sporadic cases that occur, but that is not surprising given that individuals may have risk of exposure both within their workplace but also outside of their workplace. But in general, we're in a much better place in those facilities than we were months ago.
Governor, we've been, you released yesterday the numbers for Latinos and blacks, and we know the cases and the deaths are at a higher rate than the general population, or higher than their proportion of the population. What's being done, or what can be done to try to reverse those trends?
Yeah, and I want Dr. Hurley to address this as well. So two things are higher, both the incidence of the virus and the fatality rate from the virus among those who contract it in our Latino and our black communities. So higher hospitalization and higher death rate and higher incidence. Of course, the very first piece to addressing this is shining a light on it and showing these disparities. And we've pushed and pushed and pushed, first the hospitals and the data, to have the data that we started to show some of these disparities. I think it was about 2 months ago, and now with this added piece of data today. A lot of these are enduring social inequities that there's no simple aspect to. They're a result of the long tail of systemic racism. That means disproportionate access to health, income levels, education, all of these factors that correlate with the virus. I'll turn it over to Dr. Herlihy to further address this.
Yeah, I would echo the governor's comments. I think the first really important step, as he said, is to shine a light on this problem, and I think our website improvements go a long way to showing this type of data, both for cases, deaths, and as well hospitalizations. I think that we also see disparities among hospitalizations, and so I think having access to this data is really important to make sure that we are sharing this information, that the public knows that this is an issue. Our county level partners are also working in their community. We're doing lots of outreach work, and the governor's been involved in some of that work, specifically reaching out to our Latino community to make sure that they have access to the information they need. We're pursuing lots of work. Our contact tracing case investigation work is in multiple languages to ensure that we can really reach the population that we need to reach, both with information but also with our public health services that we're offering.
And the free testing is a big part of that too, because the earlier you can identify it, that means that it's, you know, it's member of the households who, you know, went to work and might have got it at work, and if you identify it early, it won't spread to grandma and aunt and uncle and the kids and everybody else. So that's why the free, quick, easy testing sites are fully bilingual, English and Spanish. In Water World, they're also translated into Hmong and Farsi. So really getting out the word to communities, so no matter what language you speak, this is a very quick, easy experience for you to get tested, and then the protocols of how to quarantine if you're positive provided in your language.
Hello, Governor. Jesús Carrasquel from Noticias Univisión. Gobernador, teniendo en cuenta los casos positivos de coronavirus en la escuela Fort Lupton y una en Colorado Springs, ¿cuáles son las medidas que va a tomar para que sea más seguro el regreso a clases? Y otra pregunta sería, ¿qué me puede hablar de la última llamada?
La última llamada por alcohol va a ser a las 11 de la tarde por este mes. Vamos a mejorarlo. Antes de ahora era 10 de la tarde, pero ahora somos un poco más seguros y podemos caminarlo hasta las 11 de la tarde por ese mes. Pero todavía es muy importante tener cuidado en lugares entre de edificios, por ejemplo, bares y restaurantes. Y todos saben que cuando alguien está borracho es más difícil tener distancia y vivir con responsabilidad. Y por estas razones es muy importante tener cuidado entre edificios como bares. Su primera pregunta otra vez, por favor. ¿Algo de escuela? Okay, I might be gone. But la procesa de cerrar y abrir escuelas es informada de la información de ciencia. Y cuando hay algunas personas que tienen coronavirus en una escuela, la escuela necesita cerrar por 14 días. 14 días y entonces abrir otra vez. Pero si hay solamente 1 o 2 estudiantes en una clase que tienen el virus, solo necesita cerrar esta clase por 14 días, porque no hay evidencia que el virus está circulando en la población general de escuela.
Governor, it's hot right now, but obviously the temperature's going to change, the weather's going to change quickly in Colorado. I'm wondering if your administration is developing plans or procedures for, once it gets cold in Colorado, people start congregating inside. I feel like there's a potential for disease to spread much quicker, and how you guys might address that and get the public message out.
Yeah, and I would say ski season is a part of that. We are looking at the data from the southern hemisphere and steps that have been taken in countries that have been experiencing winter while we have summer, Argentina, Chile, learning from those experiences. Yeah, there's some things that we can keep up through the fall, like outdoor dining at restaurants. We have a wonderful September and October. I think, November by and large. But yes, in December and January and February, we know in Colorado there's a lot of days where folks are not likely to want to dine outdoors. So we're figuring out ways to do that. We're figuring out ways that we could be safer indoors with better protocols, as well as how we can meaningfully employ the outdoors during our cold season as well.